Welcome back to part 2 of the Introduction to Co-Occurring Disorders, part of the Quickstart Guide for Recovery from Addiction and Co-Occurring Disorders by Dr. Dawn-Elise Snipes. In the last video, we talked about what co-occurring disorders were. We talked about depression and we talked about hypomania and mania. In this video, we're going to talk about anxiety to start out with. Anxiety is another common, very, very common feeling in the early recovery process. And when I say early recovery, I'm talking about your first year. I'm not talking about necessarily just your first week or 30 days. During this early recovery process, your brain is still trying to rebalance some of the brain chemicals, but you are also recognizing some of the damage and devastation that occurred while you were in your addiction, which can cause feelings of depression and anxiety because of the things that you've got to do to repair that. You also may have some anxiety about the next steps you've got to make in order to become the person you want to be. Just like in the past video, you're going to go through each symptom of anxiety and identify how that symptom could trigger an addiction relapse and how you could cope with that symptom. This one's going to take it a little step further though, because people who have anxiety often may also have depression. When you are stressed out and you are revved up for a long time and you're really anxious, at a certain point you may start feeling hopeless and helpless, and that depression may kick in. People who are anxious also tend to have more pain, partly because their serotonin levels are low, and partly because when we're anxious, we tend to have a lot more muscle tension, which can trigger migraines, it can trigger TMJ, it can trigger neck and back pain. There are a lot of things that it can trigger. So I want you to think about when you are feeling anxious, how does it trigger depressive feelings? How does it trigger pain? And how could it trigger addiction? The symptoms of anxiety include feeling restless, keyed up, or on edge. You can't sit still. You feel like you've got to be moving all the time. You get bored, have difficulty concentrating. Well, we'll get back to that in a minute. Most of us know what restlessness feels like. How could restlessness trigger an addiction relapse? When you're anxious because you are kind of revved up all the time and you're never able to relax, you can get easily fatigued. Why or how could that trigger an addiction relapse? Some people will use downers or depressants to help them relax. Other people will, when they're feeling easily fatigued, may turn towards stimulants in order to help them have energy. Either way is considered a relapse. People who are anxious may have difficulty concentrating or their mind going blank. When we are anxious, there are chemicals in our brain that are telling us to fight or flee. They're telling us, concentration and higher order thinking is kind of overrated right now. You need to fight or flee. So when you have high anxiety, your memory is going to be crap. Your concentration is going to be crap. Just expect it. That is your body trying to protect you from whatever threat it perceives. Pay attention to that. Know how you react. Know how it could trigger a relapse for you. And identify 3 ways of dealing with it. Irritability is another symptom of anxiety. When we're anxious, when we're stressed out, when we're on edge, and people irritate us, we have less patience. We're already feeling revved up. We're already in that fight or flight sort of state of mind. And it reminds me of a boxer in a boxing ring, the way they bounce around on their toes all the time. That's what we're like when we are anxious. And so we're already poised to fight or flee. So when somebody does something that normally would just kind of mildly irritate us, we can experience a much stronger reaction when we're already anxious. So irritability and a lot of things that normally wouldn't bother us probably grind on our every last nerve because we are on our last nerve. As I talked about before, muscle tension, which can cause pain, can also keep us from sleeping well, which contributes to fatigue. How else could muscle tension and pain trigger addiction or addiction relapse for you? How can you deal with it? And just like with depression, there are often changes in your sleeping patterns. You probably don't sleep as well. You may toss and turn, have nightmares, not be able to sleep because you're so stressed out. And eating changes. A lot of times when people have anxiety or depression, they gravitate toward high-fat, high-sugar foods because that causes your brain to release pleasure chemicals. While those are, foods that you can eat and there are calories in them, they will keep you alive. You need more than high-fat, high-sugar foods for nutritional balance so your body can make the building blocks and hormones it needs to help support your brain and body's recovery. So again, if you are not eating a relatively healthy diet and getting at least 7 to 9 hours of good quality sleep every night, you're probably laughing right now because you can't remember the last time you had that, but that's okay. I want you to think about what are 3 ways that you can address each one of those things in order to keep that from being a stumbling block in your recovery process and triggering a relapse. The other mental health issue that we're going to talk about is ADHD. There are a lot of people who are in recovery from addictions who also have ADHD or ADD. When you have ADHD, and I'm just going to kind of go through the symptoms real quick. We're doing the same thing. You're going to look at how each symptom may occur for you, how each symptom could potentially trigger a relapse, and ways of dealing with each symptom. You also want to think about how ADHD may trigger feelings of depression for you. Some people, when they have difficulty concentrating and organizing and following through, and people get angry with them because they make careless mistakes, they feel bad, and then they can start to feel hopeless and helpless and depressed. So do think if you've got ADHD symptoms, whether you meet the full criteria for diagnosis or not, it doesn't matter. If you've got the symptoms, it's important to notice those symptoms, be aware of how they impact your mental health as well as your recovery, and 3 ways to address each one. So failing to pay attention or making careless mistakes, not following through, having difficulty organizing, disliking tasks that require sustained mental effort, being easily distracted, being forgetful or fidgeting and have difficulty sitting still, constantly being on the go, kind of like you're driven by a motor, talking excessively, having difficulty waiting your turn, and interrupting are all characteristics of ADHD. Now let's think about a couple of those and how they might contribute to addiction relapse. Not following through with things. Recovery takes follow through. So if you think that, hey, I'm going to go to a meeting this afternoon, and then you don't actually go, that's a problem. If you have difficulty organizing your day so you can get everything done and have time to go to a meeting or do your big book study or go to counseling, that could be a relapse trap. If you're easily distracted, you're on your way to the meeting and then you drive by a pizza place and you're like, ooh, I'm hungry. And you go off and get something to eat and then completely ditch the meeting. That could be a relapse trap. You can also have difficulty when you have difficulty organizing and planning. You might not plan ahead and think, okay, what types of triggers may be in my day-to-day that I need to plan ahead for so I can either avoid them completely or plan for them so I can cope with them when they occur. Maybe you've got to have a meeting with your boss that you know is going to be stressful, and that is a relapse trigger for you. Well, you can't ditch the meeting. So how are you going to deal with that? Making a plan ahead of time is important. But people with ADD and ADHD have a lot of difficulty with that, which is why having a sponsor or a coach to help you is really, really important. Finally, co-occurring physical disorders. We've talked about pain a little bit, but it is important to recognize that people who have physical health issues, those physical health issues could also serve as a trigger for relapse. Autoimmune disorders like fibromyalgia and Crohn's disease cause people a lot of pain, and we know pain can be a relapse trigger. Diabetes can make people feel frustrated that they have to test their blood sugar all the time, or using the needle just to test their blood, even though it's just a little needle, could be triggering for people who were injecting in order to abuse their substance of choice. Diabetes also makes your blood sugar go a little bit wonky sometimes if it's not well maintained, and that also can be a relapse trigger. And finally, hypertension can occur as a result of using, but it can also make people feel frustrated and feel like there's no hope, and that can trigger a relapse as well. So it's important to recognize any physical health conditions you have, if they're on the slide or not, and how they may contribute to you feeling anxious or depressed or angry, and how that might lead to a relapse. Addictive behaviors are a creative solution to a problem, which unfortunately, it also causes more problems in the end. Mental and physical health issues can be caused or worsened by addictive behaviors. Recovery involves developing an awareness of what triggers your mental or physical health problems, identifying the addictive behaviors that you often use to cope with those problems, and developing alternate skills to help you deal with life on life's terms.